Hey guys, welcome to episode 2 of the Function First podcast. Last time we were on, we had Dr. Ted Dower, who talked a little bit about how there are cases where people have been misdiagnosed, where they might be exhibiting symptoms, they've been diagnosed in the past, and think that it might be something like a disc herniation, for example. I told a story about how I had a patient come in with that exact scenario, and it ended up being a muscle in his glute called his piriformis that was causing some of that radiating pain, and he went through a ton of treatment that was not helpful for him until he got that correct diagnosis, and we worked on his glute when he came in. So with that being the case, I've had a ton of patients reach out about having radiating pain with numbness and tingling, and they're wondering, hey, what is causing that? So I wanted to run through a few different options of what could be causing numbness and tingling down your arm, down your leg, causing pain in your neck, pain in your low back, things along those lines, and just talking about the importance of that diagnosis. So if you're coming into the office and you have these symptoms, the first thing that I want to rule out are red flags. So I want to make sure that you're not progressively getting weaker. I want to make sure that you're not losing bowel control. I want to make sure that you don't have saddle anesthesia, which means it feels like you're sitting on a horse saddle. You can feel that numbness in that area. You don't have balance problems. I want to make sure you don't have the worst headache of your life, or drooping in your face, no major accidents, pains, cancer history, unexplained weight loss. All those things to rule out some level of cervical myelopathy, cauda equina syndromes, stroke, cancer. But we can do a lot of that through our history right when you come in. And that's why I ask a lot of questions if you're a patient of mine. You come in, we're making sure that there's nothing that's a red flag where I'm going to need to send you to the ER, send you to the hospital, someplace other than my office. So if you're in here, we rule all those out. Now we can get into things that we can treat. So first, we'll focus on the upper extremity. Almost every time you're feeling numbness and tingling, there's going to be a nerve involved. With that being the case, we want to find out first, is it coming from the spine? Is it coming further down where that nerve could get impinged? Where is that pain originating from? So the first place could be your spinal cord. There's a few different things that could cause this. It could be a disc herniation where that disc is pushing into that spinal cord itself. It could be an osteophyte where the bone starts to spur off into that spinal cord. It could be a tumor, things along those lines. So once again, we want to test and just see what's causing this numbness and tingling. In the case where it's hitting that spinal cord, you are going to see it potentially go to either side. So it could switch limb to limb. It could go left leg, right leg. It's not going to be totally localized to one often. We'll talk about what causes that in a second. But with it being the spinal cord, usually you're going to have some level of low back pain with that too. That's not going to be isolated to just numbness and tingling. The next is like it, where it can be those same causes, like I said, the disc herniation, osteophytes, things like that, but it's going to be usually on one side. So if we're getting an impingement on a nerve root, you're going to feel it only on one side of your limb. Typically, you're going to feel it more with lateral flexion or rotation. And usually, if it is a nerve root issue, we're going to be able to track that dermatome, which means what area of your arm or hand those nerves innervate. So for example, if your C7 disc is impinging that C7 nerve, you're going to have numbness and tingling into this middle finger right here. So if you have pain here that correlates with that middle finger, hey, we're getting on top of this, that it might be that C7 nerve root that you're feeling being impinged. So it is not always an impingement in your spine, though. It could be an impingement down the line. So next we're going to talk about thoracic outlet syndrome, because it's a great example of how a muscle or a bone further down that chain can impinge on that nerve and cause similar symptoms. So just because you have arm tingling and numbness, it doesn't mean that it's necessarily the spine. With thoracic outlet syndrome, there are a few different things that cause it. One is your pec minor that runs across your chest here. There's another muscle that runs down the front of your neck called your anterior scalene. And then you have two bones. You've got your clavicle here, your collarbone, and you've got your first rib right underneath that. So the combination of those four structures forms this little outlet like this, where all the nerves, arteries, and veins need to run through. So if that outlet starts to close down, we're going to start to feel some of those symptoms refer down your arm. Now, to relieve those symptoms, we typically need to either relieve the tightness in that musculature, or we need to relieve the immobility on the joints on each end of those bones. So we just need to essentially make that tunnel larger. So often we'll have patients come in where they're convinced they've got a disc herniation, or they've got some level of issue in a joint in their neck, and it's actually more this pec that's the issue. So what do we do to fix that? They've likely been rounding forward while they're lifting or while they're at their desk throughout the day. So we've got to take some of that pressure off of that pec, make sure that all these joints in the area are moving really, really well, and we can get some of that pressure off of that nerve. All right, where else can that nerve get impinged? I'll keep these a little bit shorter. There are more tunnels down the arm, like your cubital tunnel or your carpal tunnel. If that's the case with this carpal tunnel, of course, you always feel it right through here, where you've got that transverse carpal ligament that runs right across the top here. That's something that we could work on as well to try to relieve the pressure off of that carpal tunnel syndrome. The other is a cubital tunnel syndrome. That one hits the ulnar nerve, unlike carpal tunnel that hits the median nerve. With the median nerve, you get your thumb, your pointer, and your middle finger. With the cubital tunnel, you might have pain through here that radiates into your pinky and your ring finger. If that's the case, again, we just want to get the pressure off of that nerve. So we're going to work through some of these flexors in your elbow. Your UCL might be a part of the issue there. We can work on your radial head or the other bone in your forearm. Make sure that the top of that bone is moving well in its joint socket, things along those lines. So that's it for the upper extremity. The lower extremity is like it, where we want to make sure that, again, there's no spinal cord or nerve root impingement. If there's an impingement in that spinal cord, again, you're going to feel radiating pain going to each one of your legs. Again, that can bounce back and forth, just like the upper extremity. Same deal, where we can find out which nerve root by looking at the dermatomes. So we can say, okay, are you having numbness and tingling across the top of your thigh? That might be L3. Is it behind your ankle and into your pinky toe? That might be S1. Again, those usually also have that low back pain, unlike some of those muscular impingements that go further down the chain. You might not have low back pain with it. Usually there's going to be a lot of glute pain, for example. That'll be my first example, is piriformis syndrome. We've talked about that in the past, where you have that piriformis muscle that runs over the top of that sciatic nerve. So all those nerve roots come down and form that sciatic nerve. So same deal, you might feel tingling in a specific area that fits a dermatome, like we were saying earlier. So you might have numbness and tingling in the pinky toe. You might have it on the top of your foot, where it would be an L5 disc herniation. And it might replicate those symptoms, but actually it's just that sciatic nerve getting pinched down by the muscle. So that piriformis runs over the top of the sciatic nerve, like I said. Some variations of the piriformis muscle, the sciatic nerve actually runs through the middle of it. So you can imagine if that muscle gets tight and builds adhesion through it, it can pin down that nerve, and you're going to get that reproduction of symptoms right down the leg. And you're thinking, I've got sciatica, I've got a disc herniation, something along those lines, where in reality, it's actually just that muscle. So similar to thoracic outlet syndrome, we would want to work through that muscle, so do some level of muscle release. We want to make sure that we're adjusting your hips so that you've got good hip and joint mobility, so that muscle isn't overcompensating for the movement of the hip. And then, of course, we want to head over to the gym. And we're going to do mobility work. We're going to do strengthening work. We're going to make sure that piriformis muscle is doing its job, and not only its job, but not someone else's job. So we don't want it to be compensating for other musculature in the area. So sometimes it's strengthening something like your core stability, where we take that load off of the piriformis, and now it's able to be used for what it's meant to do once again. So we've got the spine impingement, whether that's a nerve root or the spinal cord. We've got the muscle entrapment that could cause pain radiating through that nerve. And then there's a few other things that it could be. One is peripheral neuropathy. So that, again, is not as much a mechanical issue as it might just be alcohol abuse, vitamin deficiencies, diabetes, something along those lines that's causing your pain. Again, some of that's going to be the history of, hey, does this not exactly match some of these biomechanics? Are the orthopedic tests not coming out positive? Are the neurological tests not coming out positive? Do we have an MRI and there's not a lot showing up? Hey, we're going to look into what are you eating? What does your diet look like? What are your diabetic markers? Is there a history of alcohol abuse? Things along those lines where it could be that peripheral neuropathy. The last one is vascular causes. So as we do a lot of the orthopedic tests, we can see, is it truly a nerve, which is the most common, or could it be an impingement of that artery or of that vein? Because if that's the case, you're going to get a change in temperature in your hands. You can get some of that weakness going on as well. And then it can become somewhat dangerous, especially with this thoracic outlet syndrome, where if you get a lack of blood flow to the area, you get swelling, you get that limb turning purple, and you get that deficiency. Now, that's much less common than some of that numbness tingling, but it's something that is possible in overhead athletes like tennis players, baseball players, things along those lines, overhead lifters, where we just want to make sure that there's no case of any blood not being able to travel into or out of that limb. So overall, just to recap, what are we looking for? We first of all want to make sure, number one, you don't have a red flag, but if it's more of a mechanical issue or more of a diet-related issue, things along those lines, it's something that we can address here, make sure that we work through, and we'll take good care of you. So, like I said, we can do that with orthopedic testing. We can do that with neurological testing. If we need imaging, we can do that. And then from there, we can make sure that we're treating you with soft tissue work, we're treating you with adjustments, and we're treating you with rehab, all of which have absolutely phenomenal statistical results with nerve impingement. So if you have numbness and tingling, come on into the office. We have our free first visit link always up in our bios. So come on and stop by. We can figure out exactly what it is. Is this the cause? And if it's not, we can refer out to where you need to go. So I think that's a pretty good overview overall. Next time, we're going to have Dr. Ben Pepin on, and we're going to talk about how we treat some of these things into a little bit more depth. He's got a great technique that he's been studying called McKenzie technique, where you can use repetitive motions to work that disc back in, things along those lines. I might dive into dynamic neuromuscular stabilization, which is a rehab technique based around core stability and how you develop into movement patterns. So make sure you tune in for that episode next week as well. Thanks for listening, and we'll see you next time.